Well, a very early morning procedural vote in the Senate means that the landmark healthcare legislation has the 60 votes that it needs to quash any attempted Republican filibuster. But the vote came after a long day of very contentious partisan debate, and indeed after a long months and months of discussion and debate, not just in DC but around the country, on the issue of healthcare reform. Well, joining me now to discuss what this bill means is Dede Percin, who's Executive Director of the Colorado Consumer Health Initiative, and they are a statewide consensus-based membership organisation. They're a non-profit group that's made up of over 200 organisational and individual healthcare consumer advocates, and they work to educate the consumers in Colorado about healthcare reform. Good morning, Dede. Thanks for being on KGNU this morning.
Good morning. Thanks so much.
Well, it's a very long and complicated process, what's going on with healthcare, but there definitely seems to be some differences with this bill in the Senate than what we've seen in the House. And in particular, I'm going to point to just a few of these options, given that we just have a brief amount of time this morning. One of the big key components is the issue of the public option. Can you explain what's happened now with that in the Senate bill?
Well, I think from our perspective, disappointingly, both the public option trigger, and the Medicare buy-in, all of which were sort of more robust options, were stripped from the bill in the compromise language in order to get the 60 votes needed. And so that was really a disappointment. What there are still are some strong subsidies. The House version is actually better at low-income subsidies. The Senate's a little bit better at high-income subsidies, but there's a new choice of coverage from nonprofits. So there's going to be a new national health insurance plan managed by the Office of Personnel Management that will be offered. There still will be health insurance exchanges, although exactly what those look like we'll have to see in the long run. But it's definitely a couple steps back from, I think, what a lot of advocates hoped there would be.
So what does that mean for consumers? Does that mean that consumers are still at the mercy of the private health insurance companies when it comes to buying coverage?
For most folks, yes, because most folks get their insurance through their employer. What there are in the bill are a lot of new regulations on insurers, including limits on what they call medical loss ratio, which is how much of they have to spend of the money they take in of the premiums, how much they actually have to spend on providing medical care. The ending of rescissions, the ending of gender rating, the ending of medical underwriting, which is rating you up and down based on your health status. And also it limits annual caps and then actually does away with them altogether. So there's a lot going on in terms of regulation, but it's just not that strong public option that a lot of folks believe would put pressure on insurers to really be more efficient and more fair in their premiums.
Well, I think the absence of this public option has caused a lot of people to really criticise it, and not just that, but also the abortion language, which we'll talk about in just a moment. And I know that Howard Dean had said a few days ago that the whole thing should be scrapped. I think he's backed off maybe a little bit on that position, but still people are critical of what they're seeing as being quite a watered down version of healthcare reform, which seems to be now rather health insurance reform.
Right. And you're right. Howard Dean did walk back a little bit just yesterday on some of that, saying that the bill wasn't really worth anything. There is a lot. There isn't everything that I think most advocates would like in the bill, but there is a lot of things in the bill that are going to make a big difference. I think one of the pieces that's really problematic about the public option is that there's still an individual mandate. And which require people to buy insurance, and there's some subsidies, and there's some, depending on your income levels, some exemptions. But it's really hard, I think, philosophically for some folks to look at an individual mandate with no public option, because really what that means is you're requiring people to buy into private insurance. Now, there is going to be this new choice of coverage from nonprofit, but it's not quite the same thing as I think what people were hoping for.
Well, another point of this Senate bill that is also drawing some criticism as well is around the abortion language, and it's slightly different from the Stupak amendment that was in the House bill. And it says now that insurers will be able to offer coverage for abortion if the state allows it. However, it has to be separate, so women might have to write now 2 separate checks, one for their abortion coverage, one for their regular health insurance as well. Now, Diana Dede and some other pro-choice people have really criticised this, and Diana Dede went as far as to say that this could even be unconstitutional.
Right. And it's really, really problematic to ask women to say, this part of your health care we're going to divorce from, like, the rest of your whole body. That's a little bit absurd strategically. That said, this type of provision isn't new. Existing law already allows states to ban insurance coverage both in state Medicaid and in private markets. In Colorado, we've already banned it through Medicare along with 17 other states. So this sort of distinction isn't new. It's just really, really disappointing. I think that it will still allow insurers to provide coverage in the health insurance exchange, but it depends on what the states do, and that just creates a tiered system for women that is just really hard to swallow. Again, it was a compromise to get the votes they needed to be filibuster-proof, but it's really tough.
Well, we just have less than a minute left, Dede. What does this mean for people in Colorado, this new bill?
I think what this is going to do, really, most folks get their insurance through their employers. In the small group market, we've put some of these protections in place, but this is really going to even the playing field a lot, regardless of where you get your insurance, that you'll have some of these robust consumer protections. We are still really concerned about affordability, particularly with an individual mandate, and if the subsidies are more robust. As I mentioned, the Senate is not as good at low-income subsidies, although good at the higher end. We'd really like to see more robust subsidies. But I do think it's going to be tax credits for small businesses. There's going to be more options for folks, and there are going to be more people covered.
Well, Dede Percin is Executive Director of the Colorado Consumer Health Initiative. Thank you for being on KGNU this morning.
Thank you for having me.